Hey guys! Oh, we're very lucky. We're very, very lucky. Please meet the lovely Carrie Smith. She is an awesome animal PT from Canada, and she's going to be spending 5 days with us talking about preparation for cruciate surgery. As you guys know, cruciate disease is the leading cause of stifle arthritis, so it has massive relevance to our platform. I'm going to let Carrie introduce herself to you because she is hilarious. You're going to love this. Next 5 this lady. Please.
Well, thanks, Hannah. And, I wish I could be there in person for 5 days, but, stupid COVID. So here we are doing our Zoom call, and it's great to be here on an online platform anyway. So I have some great slides for you. So
You do share those slides.
So let me go to the slides now. Am I sharing right now? Can you see that?
Not yet. Keep
going. Let me go share screen. There we go. Okay.
Perfecto.
Now I'm going to open up this amazing presentation.
And I'm going to be the invisible voice.
And we are going to play from start. Okay. Can you see that? All right.
I totally can see it.
Okay, perfect. So today we're going to talk about this preoperative guide. Now, I see a lot of cruciate dogs. And what I was finding is that owners didn't really know what to expect. And there's so much you can do to help them prepare for this surgery. So that's why we want to talk about this today. Now, let me just give you a quick rundown of why you're listening to me today. So I am a human physio, have been since 1985, and I am also an animal rehabilitation therapist, and that was since 2004. So I have certifications in acupuncture, intramuscular stimulation, or dry needling. You may have heard of it called that. And I'm also a sport physio. I own both a human and animal practice near Ottawa, Ontario in Canada. And I have been in the past the physiotherapist for the Canadian women's hockey team and the Canadian men's rugby team.
That's
and
crazy.
Now it's cool. Yeah. And I always tell people I treat humans, animals, and rugby players because I don't know what category the rugby players fit into.
I love it.
Anyway, I have dumped all my human sport and I now only work with dog sports. So I am the physio for our Canadian World Agility team. And so this was in the Netherlands a couple of years ago with the World WAO event. Unfortunately, it was canceled last year, but we're hoping to get back this year. And I have been working with cruciate dogs for 16 years with a very specific protocol that I started when I first started working with them. And it's worked really well over the years. And that's what I want to hope to share with you guys today.
Perfect.
So this is in my canine clinic. See, this is why it's so much more fun to treat dogs than humans. So, they can sit on your lap. You get to cuddle with dogs all day, much more fun than treating humans. So
yes.
I want to thanks to Hannah and the Canine Arthritis Management Company because it was fantastic to be invited to share this information with you because I think it's actually really important information. So this would be appropriate for anyone that has a dog having a cruciate surgery or any veterinary professional who is dealing with cruciates and who can pass on this information to the owners.
Perfect.
So we are going to focus on this whole preoperative care guide for cruciate tears in dogs. And even if you don't have surgery, you can follow these guides for an acute injury that's a non-surgical cruciate injury as well. So the thing is, remember Hannah was saying a tear in the knee joint in the ligament is one of the big precursors of arthritis in the knee. So the better we rehab the surgical knee, the more we can help protect not only the surgical knee, but protect the opposite knee as well, because there's a huge risk that the second knee will tear. And Hannah, do you see that in your practice as well?
Oh yeah, it's massive. And there's certain breeds that I think it's up to like 50 to 60% will blow within the year. So because it's a degenerative condition, you've really got to protect it.
Yeah. So what I have found sort of in my career in animal rehab is that there are lots of dogs that get surgery and the surgery is fantastic. And then there's almost no rehab afterwards. most clinics don't have physios working in them. Most owners don't have access to therapy. It's not a specialty of the surgeon. Their specialty is doing the surgery. So it was like these dogs were sort of falling through the cracks. If you had a human who had a knee surgery, like an ACL repair, the surgeon wouldn't even do the surgery if you weren't going to go to physio afterwards. So
Right.
I think we really have to start getting these dogs into better rehab programs. And then, in my opinion, that would help reduce the incidence of tearing on the opposite side.
Yeah, and your figures are quite incredible. That's why I found you via Laurie Edge Hughes, who told me that you were bringing the incidence of the contralateral limb tearing down to about 18%. And
yeah.
I'm like, what?
Yeah, it's amazing. And so we did it's not an official study, so I'm not going to sort of quote it. It's not published anywhere yet, but I would love to hook up with a researcher, because we have 16 years of data. And when we just ran the numbers, our incidence of the second knee tearing was literally 18%, which is
crazy.
Way better than 50%, right?
Yeah.
So this would be a great research project if there are any researchers out there. Okay, now this is what the pre-op guide looks like. And if you're interested, I'm sure Hannah could get a PDF copy from me, and I'm happy to share this with anybody who wants it. So
that would be amazing.
It will be available.
I've been through your whole guide, and it is fantastic. So the whole process for the whole kind of 12 weeks, you've mapped every single week with these fun, easy to read, like that you stick them to your fridge and you can just track what you're supposed to do week to week. Amazing. Such a good guide.
Okay. So when we're dealing with canines, we have to remember the owners are human, and it is the actual owners that need to know this information. And so physiotherapists, we work with humans all the time. And so I think this is what we can bring to the table to the vet community, is the ability to kind of help the owner understand what's going on, because that's sort of one of our specialties. And you also have to remember that when an owner gets the news about the dog needing surgery, they are not taking in everything that you're telling them. They're in a panic. All they hear is, I need surgery. What is the cost of this? These are not inexpensive surgeries. And so their adrenaline is going, they're freaking out. They're they're concerned for their dog, but they're also concerned for their bank account. So there's a lot of stuff going on in their own brain. And so if you can give them something, if you can email them something, if you can hand them something that when they've kind of accepted the situation, they can start looking at this and start to understand what it is that you've been talking about. So they really need written materials that they can take home. The more pictures you use, the better. So you want to make it really easy. And so we have lots of tricks that can help improve compliance of owners. So Hannah, how's your compliance?
Oh, I love it. I did a talk recently about owner compliance, and I used physiotherapist research papers to try and look at how we as vets can get better adherence to treatment plans. And you guys, you see it all. The likelihood that one of your human clients will actually complete a physio course is about 50% if you're lucky.
If you're lucky, yeah.
So you guys know a lot about this.
We do. And it's tricks like don't overload them, right? 3 exercises at a time is all they can handle. If you give them 6, they won't do any. If you give them 1, it's like, well, it's only 1, so if I miss it, it's not a big deal. I always tell people
3 is the magic number. There's a
3
song
is
about
the
that.
magic number. It is.
Yeah.
And so we always tell people also, do these 3 times a day. And when we tell them 3 times a day, the type A's, you know what I mean by the type
Class
A
A personality types. Yeah.
They're going to do it 3, maybe 4, maybe 5 times a day. But if we say 3 times a day, we're hoping that they do it once a day. So we always overestimate what we want them to do because we know they're not going to do it.
Yeah.
So if you tell someone do this once a day, they might do it once a week. But if you tell them 3 times a day, you'll guilt them into doing it once a day.
Yeah.
And it's tricks like, if you have exercises you want the dog to do it around mealtime. So most dogs eat twice a day. So there you go. I have them always do their exercises before meals. So then you've got those exercises done twice a day without even really thinking about it. So just little tricks like that. So this isn't an anatomy lecture, but we just want to show you the cruciate ligament. So in the human, it would be called the ACL. In the dog, it's called the CCL. And it just creates stability at the knee. And I don't know if you can see my cursor here, but it's on the cruciate ligament at the front of the knee there. And what it does is it stops the bottom bone from sliding forwards. And so it creates stability. It is the most in North America, Hannah, correct me if it's different in the UK, but it is the most common orthopedic surgery that we see over here.
Oh yeah, no, it's massive. And there's a lot of discussion in that. I think the figures were like 2015 and it's something like $3.2 billion worth of surgery as well around the US. It's huge.
It's a huge surgery or injury. But it's a treatable injury, right? This is much better than having cancer or having, other medical things where you can't treat it. So this is treatable. It's not always a surgical condition. You can treat these conservatively. Not all dogs are surgical candidates, right? So we do have to know how to treat these conservatively as well, which really goes into then arthritis management.
Yeah, definitely. And I always remember I listened to one of Laurie's talks and she says, shame on you if you don't have a plan for conservative management for those people that cannot go down a surgical route. And I thought, God, that's just beautiful because it is. Yes, surgery is gold standard in many cases, and we've got more evidence to suggest, the TPLO versus the TTA or the lateral suture. But there's a lot of people that can't afford the surgery, and we shouldn't turn a blind eye to them. So
exactly. You still have to manage those patients. And it may not even be that they can't afford it. The dog may not be suitable for surgery. If you have a dog with a heart condition or some other medical issue that they're not a surgical candidate, you still have to try to treat this knee. Yes. So, and it's often called an old dog injury. More dogs tear this in their middle years. They're usually around 6 to 7. The young dogs who tear, it tends to be a very traumatic injury. So in humans, it's almost always a traumatic injury, like you're skiing or you're playing soccer, and you have a planted leg and you get hit. That's how we tear our ligaments. Whereas in dogs, it can be a partial tear, and then it kind of generally then turns into a full tear. But often in those middle years, not always the young dogs. Yeah. So then why do these ligaments tear? Why is this such a big problem? And we know breed is a huge part of it. So we see these tears in the larger breeds. So again, over here, it could be different in Europe, but in North America, our top 5 are the Labs, the Goldens, the Standard Poodles, the German Shepherds, and the Rottweilers. And Hannah, what do you see over there?
Exactly the same. Moderate to large breed dogs, definitely. Definitely breeds that are prone to obesity as well. So genetic obesity. And also there's the link with neutering as well. So certain breeds, there is a link to them having a higher prevalence of cranial cruciate disease. Like the golden retrievers, but don't take that as all breeds, guys. It really isn't that clear cut.
It isn't. But it just, when you look at the stats, these kind of breeds are prone to tearing. And so, thinking about that, if you're in vet practice and you have an owner with a lab puppy, do you tell them to put insurance on this dog, right? When you start to know what types of breeds are going to be prone to these sorts of things, that might be a conversation you want to have with your puppy owners. So
definitely.
Kind of something to think about. Yeah.
I think we're just about to release an owner's course, and in it, it's very much these are the breeds that are genetically predisposed to developmental disease. There's very similar breeds prone to obesity. Oh, look, these are the breeds that are also prone to cruciate. And you're like, really a pattern forming here. I better prepare. I better be wise, and I better take cautions. It might be insurance, it might be lifestyle, certainly diets. So there's lots of things to think about.
Mm-hmm. I had a fellow bring in his lab. He had a cruciate tear, and the dog was probably over 100 pounds. Like, this dog should be, I don't know what that is in your weight, but anyway, this dog should be about, 70, 75 pounds. And he comes in, and he's kind of a big guy himself. And he says, look, before you say anything, I know my dog is overweight, but I don't understand why. Because the only treats he gets are cheesies, which are like a grease stuffed like chip, with orange powder on it. He says, and they're mostly air. He thought he was treating his dog with air cookies. So no, these aren't made of air. They're made of grease. So sometimes a little owner education in the early stages of life is a really good thing, right?
Yeah, definitely.
Yeah.
We'll do loads more about weight control throughout all of these CAM episodes. Because,
and again, huge issues for arthritis, right? When the dogs tend to be overweight. Yeah,
we did a really good live with a lady called Helly, and she was talking about the biomechanics of obesity. That was crazy.
Amazing.
So, it's not all just about weight carriage, guys. It's multifactorial obesity-driven changes.
Mm-hmm. And then kind of still talking about breed, the structure and conformation of the dog will also tend to create cruciate problems. So we know in different breeds have different issues. And so we obviously, Dachshunds and Corgis and long back breeds tend to have back problems. So you can see the correlation there. Poodles, who have a very kind of straight shoulder, tend to have shoulder problems. Labs, who have a very straight back end, tend to have back or cruciate problems. So just the conformation of the breed, which there's nothing you can do about, also is a risk factor for tearing these cruciates. Then there's weight. So we've talked about weight quite a bit. And also, female dogs tend to tear more than male dogs.
Yeah.
And again, around that age, that 6 to 7 age, is where we see most of the tearing happening. But also you need to look at what's the dog's fitness level and what sports do they do. So an agility dog or a fly ball dog may have a lot more risk of tearing than a couch potato dog. But a couch potato dog is not nearly as fit as an agility dog. So, you've got to weigh everything together.
Pros and cons, isn't
yeah,
it?
exactly.
Definitely.
Mm-hmm, mm-hmm. So I think that's a good place to stop for.
I'd say so. We've just hit 16 minutes. I think you're spot on.
Perfect.
So we're going to bring back tomorrow to carry on our pre-op guide. Until then, we will see you tomorrow.
See you tomorrow.